partner at HealthCois. Mr. Mahipal brings experience of over 2 decades in healthcare investing, and having backed several pioneering health tech companies in India, he offers a unique perspective on aligning the patient capital risk appetite with long term system transformation. We are also joined by Ms. Namrita Mayanil from Visa, an innovative global health tech platform where she drives development of AI-enabled mental health solutions. And as a technology leader, she brings in an innovator's perspective on navigating complex challenges faced by innovations to scale both in Indian and international markets. From the CSR space, we welcome Mr. Nitin Vashisht, Deputy General Manager CSR at Indian Oil Corporation Limited. With extensive experience at the IOCL, he brings in insights into how large public sector enterprises are aligning their CSRs to promote AI-led innovations for improved health outcomes. Finally, the session will be moderated by Mr. Himanshu Sikka, who is the Chief Strategy and Diversification Officer at IP Global and a Senior Director at Samrid Impact Solutions. He brings in over 20 years of experience in health system strengthening, health financing across India, Asia, and Africa by working closely with public, private, and philanthropic ecosystems. With such a distinguished panel, today's discussion will move us towards pragmatic, actionable pathways for embedding AI-led innovations into public health architecture, not just as isolated pilots, but as sustainable interventions. Thank you all for being here, and I look forward to an encouraging discussion.
Thanks, Anshul, for setting the scene. Thanks, first of all, to all the panelists for joining us today. Uh, I know how difficult it has been to reach the venue itself, so thanks for making it on time, and thanks for the audience to be there. Full house, people standing. Apologies for that. We don't have any role to play with the arrangement, so can't help that. Hit the point very well that AI solutions are all, everywhere. It's like what we had 20 years back with .com, that everywhere you saw .com. Uh, but initially there were hiccups at how it will be scaled. There were technology issues, there were regulatory issues, but that for in many ways has kind of crossed that pathway. But what will it take for AI solutions, specifically in healthcare space, to take that leap? And that's something that we want to kind of discuss today with this great panel coming from different spheres, and see how it can be taken forward. Without taking much time, I think I will just get into CK sir and would request you kind of your thoughts. You have been at the helm of affairs when it comes to Government of India's efforts in the healthcare space as well as in other ministries. Where do you see is the opportunity for the Indian healthcare system to kind of really adopt AI and at that too at scale and take things forward in India's journey?
Thank you. Is it all working? So thank you, Himanshu. And yeah, very timely discussion because I think this is one aspect in healthcare delivery system which we really need to seriously sit and discuss. While technologies are developing and coming to fruition, I think the minds are still a bit hazed. So we need to bring clarity, not just on AI in health and how, but also AI in health and where. So these are two critical elements you need to keep in mind when you are talking about adoption. Let me begin with something which is not agreed by everyone. I strong believe is that AI today, particularly in Indian setting, is the greatest enabler that health sector has seen so far. At the same time, I also believe that this is not equal to healthcare delivery in India. And that is something that I would like to stress why I say this. See, there are a few questions you need to ask when you are talking about AI. But before I say this, let us remember that we have come to a stage where you just cannot do without it. So now the issue really is how to adopt it. You need to ask questions to yourself. Does this improve access? Is this creating better quality equity? Is this being more affordable, particularly in a low resource setting in India? And does this have acceptance and understanding? See, ultimately, any technological intervention must benefit someone. There are two players in this. One is the healthcare providers and one is the health seekers. So, who does it benefit and how is the great question that we need to debate? And overall, I feel that we need to really look at AI from the angle of how well it integrates with the current programs and policies. Because standalone systems so far have not shown good results. To me, one of the best usage of AI today is in the diagnostic sector. Particularly if you look at the tier 2, tier 3 cities in India and the kind of resource setting that it is, the availability of diagnostic tools is very limited. And that is where AI becomes one of the biggest enablers to reach that tool to a person who can then, diagnose on the basis of what AI is. So, diagnosis is a very powerful instrument. The hub and spoke model, which many have tried, has been successful to a great extent and should be pursued. Second is that we can use AI in screening. That is one of the India's biggest problem in medical morbidity and mortality so far has been that patients come to the clinic or the doctor, whoever it is, very late, and then it is very difficult to handle the situation. A screening is an alert system and it eliminates unnecessary hospital visits also. These are two great advantages that a patient will have if we use AI in screening, and it is already in use, and I think there's a potential of its growth to a large extent. One example I can give is, let's say, TB screening. The best weapon to finish or eliminate TB from India is to do a proper screening and make sure that we do not miss anyone. And AI can be a great enabler there. Then I think we can also use AI for another purpose, that is surveillance. Disease warning systems, particularly in today's setting, are very critical to warn people and take precautionary measures. And surveillance tools in AI have known to be very effective. So we can use that in there. Then there is this whole question that people keep asking: what about primary health care? What about preventive promotive health? And that is where I feel the clarity is still lacking. We tried telemedicines. Many people talk about, let's say, e-Sanjeevani and other such modes. If you take the total time that the patient spends on the call, I don't think any diagnosis is possible. We're only playing around with numbers. So telemedicine at the end of the day also needs a human face at the back end. And we are finding it so difficult to get that. So the entire circle is not getting completed. I strongly feel that we will need to develop newer tools if we want to enter preventive promotive health and primary health care very strongly in India. We still do not have that perfect tool which will define how it goes. And there are many other things in the primary sector. I mean, the biggest problem in the primary sector is the person who's using it at the PHC or the CHC or even the subcenter level has no idea of what he is using. So when you reach this technology to him, I think you need to reach awareness before you reach the technology. Otherwise, the usage will not be the best. You know, basically, AI is a great tool when it comes to infrastructure building, particularly given the climate impact, when it comes to resilient infrastructure, when it comes to reaching out to people with diagnostics, and it has to integrate with the national program and policies. It has to be an integral part of the entire pie of healthcare delivery system. On a standalone basis, as on date, I don't see much happening, but signals are so strong that this will be one element which will drive our healthcare delivery very strongly in future, and I hope in the right direction. Thank you.
Thanks, sir, for your insights. And specifically, when you mentioned that things like diagnostics, screening, surveillance are the areas where AI can play a role, seeing the ecosystem and seeing the kind of innovations in the expo, one feels confident that solutions exist, but one needs to now see that how they can be scaled up. And you also rightly mentioned that at the primary healthcare level is where the real challenge is, both on the preventive side as well as maybe in the referral mechanisms that we have. Is telemedicine the right solution? So, sir, glad to mention that under one of the programs which you have also led at the national level, the Norway India Partnership Initiative, a decision support system for health and wellness centers has been prepared, which kind of tries to take that step forward. But of course, we will need to see how it can be scaled going forward. And I'm also glad to say, sir, that we will hear later from Namrata on the preventive side, at least on mental health, now solutions are coming up which can act in that space and can be scaled up. But now going to you, Mr. Phelan, based on your experience of research and innovation systems in the European context as well as globally with other countries, what do you see the core foundational elements that any systems or a country like India should have to enable institutionalization of these solutions, which right now are there around us, but we need something, some common ingredient which is missing right now, or which needs to be there to take it to scale. What would that be in your view?
Yes, thank you very much for your question. Actually, I will first give you maybe a background, but I will reply to you because the complexity of India is as much as the complexity of the European Union. You are several states in one country. We are one union with several countries. So we depart from different angles, but we have the same situation. What I want to start with is that AI is not new. You mentioned the dot-com boom. I remember when I graduated, I had my first degree in medical science, and then I moved to IT because I was passionate about IT. And this was back in '89. I was student in Berlin University. And at that time, I was programming. I don't know if there are telecom engineers here. Expert system in Prolog, in COBOL, looking at database, complex database. We had expert systems. It was not called AI, but AI is absolutely not new. What is new is the scale and the investment, and we have Mr. Maipal here. But it has existed. We always had issue of how to make a system of accessing database more user friendly, more sound. And for me, this is where AI is primarily coming from. Now, so AI is coming from the data angle. Now, on top of the data angle, we are going to plug several type of tools. So, but just to make it clear that AI comes from data. And before I tell you what we, Europe Union, should do with India, I think we have to be extremely clear. And we had the EU-India summit with the EU president just 3 weeks ago here. AI is about data. Data do not belong to one country, do not belong to one company. I'm not quoting them on the western side of Europe, but we in Europe and India, we must own our data. We must own our digital technology. We must invest more. Probably India has been slow in investing in digital, even though you have talents who are working in America or in Europe. Similarly for EU, we have to recapture this. It cannot be that one country predicts the world, and it cannot be that 5 companies predict the world on our data. Data belong to the owner. They don't belong to anyone else. So this is a regulatory starting point that we, especially government, and I'm sure Mr. Mishra will agree, we must fight for. Number 2 is what AI is unfolding. AI is an enabler especially you mentioned the context of in India, in rural areas, in global south. Uh, AI for us in Europe is different. AI for us is a situation where we have less and less doctors. You have a large population, we have less. So AI will help to replace the doctors, not to replace the patients. So we are starting from different angles, but those could be complementary. What we must work together between EU and India is using AI, for example, for modeling new molecules. Of course, all the screening, especially in India, because you have a large population on a rare disease, AI makes sense. But a screening is not only the one plugging. A second plugging is design of molecules with a rapid development. My sister is a head of Novartis in Switzerland, so they are using AI. And just to tell you and give you some examples, last year the European Union we enabled an act by which we recognize the European Medical Association and Agency, European Medicine Agency, is recognizing the use of AI for prototyping. Is recognizing the use of AI for clinical trials. So this is quite new. It's only 2 years ago. Another aspect of between EU and India must be the interoperability of data. So medical records, we should use AI clearly in order that if a patient is moving or traveling abroad, the medical record follows. So of course within the EU because it's a common market, but even outside, and to be interoperable and having a common standards is the best way that no one is owning your data. You are extremely strong, and I have this telecom background too, so I know what I'm talking about in India of open source. You are open source defender. We are it's the same in Europe. We must defend open source, especially in the domain of healthcare. So those were a few pointers of what we could do together. Maybe in the second part of the panel, we will discuss about financing. Financing is a big issue because if the money is not going to health, maybe it goes to somewhere else. And we in Europe, we need health improvement of health systems as much as you do in India. You need it in India because you have a large population. We need it in Europe because we have less medical staff. So, but we need investors. We need VCs, and maybe those VCs I was speaking with Mr. Mahipal should work together. It's not only gov to gov. It's not only business to business. It's a VCs, fund of funds in Europe should work with fund of funds and identify common pilots to run in India. Back to you.
No, thanks, Mr. Phil. And I think very valid points in terms of data forms the basis for the entire AI infrastructure. And I think you rightly said that AI is not new. I think it's just that computational power has increased now that we can make use of the algorithms that existed in the past. But your second point is much more on point that capital is what is going to be required the most to take things to scale. And before we go to the VC world or the private investment, I think two key pillars that come before that is the philanthropic capital. And coming to you, Dr. Ishita, coming from SIF's perspective, and what kind of changes are you seeing in the public health space, and how is your thinking as a philanthropic organization which has been on forefront of development working with the communities, how do you see AI playing a role in this space?
Is this working? Okay. Thank you for that question. I'll start by saying that the foundational principles that have driven philanthropy are not changing with the emergence of this AI paradigm. So, for example, for us at the Children's Investment Fund Foundation, we remain committed to reaching women and children who are the most vulnerable. We remain committed to backing solutions that are evidence based and driving impact that is measurable. We also remain very intentional in our approach of aligning with the government priorities because we recognize that sustainable impact can only happen through the public systems. Having said that, while those principles are constant, our operationalization of those principles is definitely shifting. So, for example, like Sika Mishra sir said to begin with, there are existing inequities in the health system. And what we are observing is that with the advent of AI, especially its deployment at the front lines, there is a chance that some of them might get reproduced or might get amplified. So, our role as a philanthropy comes in to safeguard against that. In the systems that we help build for the government, we are going to be very intentional to prevent emergence of these new inequities or to help bridge these access gaps if they get created somewhere. We see a lot of examples now. Himanshu, you mentioned decision support systems, LLMs. A lot of them, when they are being used by the frontline workers, they need to be deeply contextualized. We see a lot of computer vision models, or even for diagnostics. Our job is to ensure that they are trained with the right kind of representative data sets, especially, for example, uh, on children with rare diseases or children with disabilities. We need to ensure that the digital tools that we are creating, they are made to work in situations where there's going to be low bandwidth, where there is going to be the operator using them is not going to have the highest levels of literacy. So we see the role of philanthropy in coming in here to stress test technology, to ensure that it is adaptable in these realities of the public systems. Apart from that, what we are also having to change is definitely our own agility. So the pace at which the AI adoption across the health systems is progressing, we are definitely having to come in a lot earlier and support faster cycles of innovation. However, at the same time, we are having to ensure that the faster pace of innovation still meets the rigor that is needed to for it to be adaptable in the public systems. And while we are fastening up pace of operationalization, I think there is also an increasing understanding in philanthropy that the capital that we deploy will need to be very patient. These systems are evolving in real time. The innovators are learning, we are learning with them. The government is adapting to these, and we're sitting at the AI summit today. The government has been very responsive to these changes, but at the same time we understand that there will be a need to iterate these solutions till they are made absolutely fit for purpose for the situations where they are going to be deployed. So broadly, the why is not changing for philanthropy, but the how is shifting.
Ishita, for bringing the points around the need for be agile as well as patient. So while it means that AI is moving fast, so we have to be agile, but at the same time we have to have the patient capital available to ensure that those catalytical solutions are kind of tried, tested, and showcased to the government to take it up further. And Nitin, to you as well, like it's great to see CSR doing a lot of work, but then also a PSU like Indian Oil spending up a lot of its CSR on technology solutions. We have seen you support drone solutions in the past for medical supplies. Now you're also looking at AI solutions. What is the thought process behind that? How much is AI being driven within Indian Oil itself, as well as how you are seeing it impacting your CSR work?
Uh, Thank you, Manchuji, for the question. Well, I'll pick up from what Mishra sir just stated as far as and link it to CSR part. See, he said, as far as CSR is concerned, I'll say the belief, the faith combined together, leading into acceptance of what is being done as far as AI interventions in the systems are concerned is very important, and where they are being implemented. So now at Indian Oil being a PSU, and I'll talk maybe, having an opportunity to interact with other PSU members also, we are still more into when we talk about the AI interventions in the healthcare sector, we are more into the equipment part. We focus on the capital expenditure. So now that is one, we consider this as one of the barriers. And the barrier is in the sense that that is how the policy gets defined. It's the what we are looking at is the support from the government infrastructure, from the government hierarchy, in the sense that we are able to, take the solutions which are provided by the AI. Now, AI solutions are more or less, if you see, apart from the equipment, if we look at it at the other sustainable, if we want to make it on a sustainable models, they will be more of operational expenditure, which more or less majority of the PSUs tend to avoid, again due to there are the policy interventions which are there, which prevent us from seeking or asking, maybe measuring the benefit, the measuring the impact on the beneficiaries that are coming up in this entire process, or covered in this entire process. So AI still to us is like a stethoscope in this century as far as healthcare is concerned, which is reading, diagnosing, and trying to enter into the ecosystem of the PSUs, CSR. So that is something where we want to progress more and more. We want to have these interventions more and more. And as you just said, that we at Indian Oil itself, if I talk about, we are already, sir was talking about, Mr. Sir was talking about diagnostics, screening. We've been doing that. We are providing high-end equipment to, not only the premier institutes, but even at the rural levels. We are providing TB diagnostic equipment, which is again AI-based equipment. But again, the equation is that everything goes around the capital part of it, the equipment part of it. But the end result, how do I measure it? How do I see the benefit out of it? Takes some time. Now, the policies, the nuisances associated with it do not allow me to go beyond a period of 1 plus 3 years. So the AI system or the interventions that I might have in the current scenario or in the future to come, in the recent future, would be something that will not allow me to go in for certain projects, which might be very beneficial for the community as far as CSR is concerned. So what we are looking at is that we are having, maybe in the near future, and what we have done is we have started doing that. All the PSUs have started doing that. We are having now collaborations. We mainly focus on the capital part, but then we have collaborations with the AI innovators and the institutes or the organizations who are working in this field, and we go in a hybrid kind of a model. So that helps us in the sense that we maintain the capex part also, the focus on the capex part, and the collaborators that are pitching with us, they help us in getting the data or the benefit which may be beyond the cycle of 4 years, which may take time, and which may does take time to sustain or give us some benefits. So that is how what we look at CSR. And then again, CSR, there is one more thing that maybe in due course of time will come in, and will have to come in, if we have to look at the interventions that are increasing the way it is increasing, is the thought process of the PSUs needs to change, and it is changing. I can assure you for that. PSUs, like the entire CSR budget for the country is around 35,000 crores. The PSUs contribute 1/7 of it. But that is and CSR fund cannot be looked at as if it is a solution to the entire problem. CSR fund is basically a gap funding. So when you look at a gap funding, you have to identify the right processes. You have to, and the most important thing in CSR as on date in the country is the compliance, the statutory compliances that we have to do to ensure that there is no misappropriation of fund at any level. So we are looking ahead with for partners, and like this year itself in healthcare, we have gone ahead with three particular projects where AI intervention is on a higher side. But now the problem that as a PSU I am facing, or being a functional head of a oil giant in this organization, which has an average budget of around 500 CR to spend in every year, the problem I am facing, I do not have benefactors who are coming to me and asking me to, have a collaboration. So that is something where we want to portray ourselves. All the PSU, the entire PSU network, want to portray itself in the sense that we are looking for partners, we are looking for collaborations, because the AI intervention, as far as the PSU is concerned, will be most probably and you can say in an entirety, will be a two-stage process, wherein for the first 3 years maybe we will still continue with the traditional aspect and have some small collaborations, and then gradually, maybe after 4 to 5 years, we'll have when once the AI solutions provide us with the confidence, we will have more funds getting into it.
Yeah.
Thank you.
Thanks a lot, Nitinji, for bringing across a very key point, collaboration. I think the point that you made, that while you can put in money for capex given your constraints and policy issues and constraints on the CSR law in the country, you need collaborators to come in who can provide the long-term vision for the programs, where capex is just plugged in. And I think maybe at some stage, SIF and PSUs could also talk together and see how collaboratively work could be done. Uh, but the big elephant in the room, Ajay, is the private capital, because government will come at one stage, but a lot of money will need to be pumped in from the private capital side, and both at the VC level and as well as the PE level. And you have played both roles across your funds. Where do you see the appetite for Indian AI solutions from the VC world, from the PE world, and how is you seeing that market maturing? Are you seeing enough pipeline of solutions that are investable? You have already invested in quite a few, but what's the roadmap that you see forward?
Yeah, no, that's a very interesting question, and thank you everyone for being here. Uh, and everyone has essentially supported this initiative. At HealthQuest, we are essentially India's leading healthcare innovation and impact fund, and fortunate to have backed some of the market leading companies in the healthcare AI space, which have not just solved for affordability, accessibility, and quality of care challenge in India, but also at the global level. And some of the examples being, and some of our portfolio companies are already here. We have Visa on the panel, and we also have Cure.ai being represented. Both these companies essentially built their frugal innovative model in India, and took those model after essentially scaling up in India for a certain time, have then taken these solutions global, and both these solutions are now deployed in over 100 plus countries. Visa in the AI and mental health space, and Cure in the AI radiology space. So it's a classic example of how you could essentially build great technological solutions at the cutting edge of innovation, and it's built on Indian data. Indeed, it was built at a time when data was not even price so heavy. Today, if somebody were to aggregate that kind of patient data, that itself might cost you $200 million and above. But they were able to do this, and now they have a repository of over 1 billion images. So that allows them to essentially come up with solutions. They have 19 US FDA approvals, Cure, which is probably the highest for an Indian company in the disease screening space. And they have taken the solution from tuberculosis. As my fellow panelists said before, 28% of the TB burden is in India, and it's an autonomous tool endorsed by WHO, and is essentially used widely, not just in India but in other emerging countries as well. Similarly, Visa essentially has supported and promoted public health, not just in India but also in other emerging countries. So we see great solutions coming out of India. However, when you look at any AI company who's devising a solution in India, you need to look at three pillars. One is IP development. This itself, the product development itself, takes a lot of time, and that's why it needs to be supported by long-term patient capital in any form, plus also grant funding, because these product to be developed essentially takes a certain number of time. You need great talent to essentially develop some of these algorithms, and essentially that becomes your foremost foundation for a great solution. Second pillar comes is adoption, which is when you do pilots in healthcare specifically, because it's a sensitive sector. You essentially need to drive numerous pilots. And third comes your state of commercialization. So all of this essentially in case of great product companies take a lot of time, and that's why as my fellow panelists said, you need a lot of patient capital and all forms of capital, whether it's government support, grant funding, private capital, CSR funding, all kinds of capital for either at a project level, some at a company level, to essentially take these solutions to sort of all parts of the country. And this is the only way, because in India we are short by 1 million doctors, 2 million nurses, 3 million beds, and if we essentially want to solve this linearly, you would essentially need over $100 billion of capex and maybe about 9 to 10 years to essentially do it infrastructure wise. So you need technology and AI solutions to essentially solve for this in a resource starved country like India. And I think some of these companies have done a tremendous job, and more are coming across the space, from disease screening to diagnosis to drug discovery. We are now seeing a multitude of players coming up, and it's a very exciting time to be looking at some of those early growth opportunities in India.
Thanks, Ajay. I think it's encouraging to hear from you in terms of that, how the solutions that we have already invested in, how they have grown over the time, and what kind of barriers new solutions would face entering who are trying to enter now. Namrata, coming to you, Visa, as Ajay also mentioned, has scaled in many countries. It's an Indian startup. The idea came from India, but I think scale up across the globe has been much faster and quicker than in India. What is the key difference that you are seeing in the Indian context, which which you have not faced abroad when you have been scaling AI solutions? So some light on that would be useful.
Can you hear me? Hello? Yeah, I think this is better. So I think thanks for having me here, and great question, I think. So Visa has been there for 7, 8 years now, and we have had successful commercial launches in US, UK, a bunch of other countries. Coming to India, I think the two I would like to highlight is one, just the socio-cultural economic diversity in India and just understanding the nuances. For us, when we started, I think the struggle was, how do you make this Visa or the healthcare, mental health that we are giving available to a 13-year-old girl in a tier 2 or a tier 3 city in Maharashtra, right? I think that was the question. And how do we make it intersect her real life? So I think just the kind of nuances that we had to face and solve for has been an eye opener in the Indian context. So that's where we came up with a very innovative solution of intersecting the digital tools that we had within her physical world, right? And that was the idea where DreamKit was born. More about that later, but yeah, I think that was a very, very interesting learning experience for us, and a challenge where we spent a lot of on ground effort to understand, how do we cater to the Indian problems? How do we cater to the Indian mental health challenge? Like, what exactly are those? Like, what are the mental health challenges that are there or pertinent to the audience here? I think the second one, which was also a big roadblock, was the lack of just a reliable reimbursement pathways, right? Like, coming from US and UK, there are very centralized, reliable systems of insurance or NHS in UK, where they do the policy. There is a somebody who's willing to pay for general therapy, but in this case, even preventative therapy, right? I think that was one thing that, coming to India, there was just a lack of like a central reimbursement pathway for us. Typically, there are four players in the market, right? There is the user, who is the person or the patient in this case, and or there is the employee, and then employer, and then there is the insurance, right? In India, specifically for mental health, and in more so in the preventative mental health, none of the three players are willing to pay. So how do we? And it could be lack of awareness or lack of just having a paying channel for it. So I think just being able to solve and just being able to commercialize, or at least in the towards the idea of commercializing it, has been a challenge. So I think, yeah, those were the two big ones. Um,
Thanks, Namrata, for that. I think you rightly pointed. Yeah, you rightly pointed that besides the solution being there, besides the kind of ecosystem players sitting on the dais here, you also need ecosystem players beyond that. Who is going to pay for that service ultimately? Is the user going to pay? Is the insurer going to pay? Is the government going to pay? Because that's very critical for scaling any solution. And the bigger point that you made was that cultural context is very critical for a solution like Visa, which is into mental health. First generating awareness about mental health in the country is a big issue. Then saying that AI could solve a solution, can provide a solution, becomes a much larger challenge, and that goes on for other things as well. How comfortable are we in this room if tomorrow AI was to kind of suggest a prescription for us to kind of take medicine on? Will we be comfortable with that? So those cultural things also come into play a lot. I think it's been a very interesting discussion, and I'm just also conscious about the time. So the second round, I would want to kind of take a very quick one. If we were given a kind of a magic wand, and we were to suggest few things which would change the paradigm for AI adoption in the country, which will enable scale to happen from perspective of the government, from regulation, from international cooperation perspective, what would that be? CK sir, would request your thoughts from the government perspective. What do you see as the key game changers?
No, thanks. In just about half a minute, thousands and thousands of brilliant solutions are being designed. Not even one fourth of them are going to scale. If they don't go to scale, do not benefit the large masses of population. So what do we do to ensure that they go to scale? I mean, I won't go into details, but three quick points. One, stabilize them, finance them, and encourage the one which you think is best suited for the setting for which it is being designed. Second, integrate them with the overall national program in a manner where adoption becomes easier and acceptance becomes the norm. And third, I think if you want to design something brilliant, it must reflect the felt need of the people. You can't design in isolation, however brilliant it is. You must address what the people want and what you think is most needed for the country. Thank you.
Thanks a lot, sir. Finon, from your perspective from global learnings.
Yes, on global learning, and I will be quick. I will not speak only about money, even though we definitely have to invest more. It's a technology transition, AI. So any technology transition need a huge amount of finance. No, I want to outline quickly two aspects that we have not discussed enough on the panel. Number one is talent. We must, between Europe and India, you have talented engineers, talented doctors. We must train them to AI. So we must have a curriculum of what this technology transition is bringing to practitioner, to people in a hospital. To so this talent aspect is important. Number two, ethics. Uh, I believe this is a common point, at least that we have between Europe and India, is ethics. Everything you do has to be ethical. So from the I mentioned a lot about who owns the data, but everything, how you have developed your software system, how you use it with your patient. So we must work together, and I will be very inclined to have master programs on ethics and AI in health, bringing European universities to come to Indian universities, how we do it in Europe, how we approach, how we teach young talent on ethics. So I don't speak about money, I speak about people.
Thanks. Dr. Ishita, maybe.
Thank you. Sorry. Yeah. So I think what is really needed, and I speak from the philanthropy perspective, where we want solutions to ultimately be transitioned into the public system. What is really needed is, again, incentivizing innovators to build for the problems that are high priority on the government agenda and solve for the public systems. You have Himanshu sort of waved that magic wand and brought together different types of capital. I think us working together can ensure that we encourage the tremendous amount of innovation that naturally gravitates towards the private markets to also solve for these problems. Philanthropy can be a starting point. We can help de-risk those solutions and get it to a point where more sustainable forms of capital, the eventual being government adoption, but also private capital and CSR can come in and support them. So that.
Thanks.
Just a quick one. I think government has taken a lot of initiatives. I think we will see a sea change in next 5 to 10 years. The RDIF fund, which has come about on the deep tech side, there's a separate 2,000 crore allocation for deep tech investment separately, and a lot of DFI capital, both from India and globally, which is getting channeled into this. I think this should essentially allow for a lot of patient capital to come in, and a lot of innovative startups essentially now getting that funding to essentially build scalable, sustainable solutions in India. So I think exciting times are ahead for the Indian startup ecosystem, especially in deep tech and R&D and AI.
With CSR perspective, I would just say that the evolution of AI systems will occur with governance, changes in governance, financial measurement, and the ecosystem levels. That is the only thing that will be required. Internally, the PSUs need to change with their approach. We have to move from an output based approach to an outcome based approach. So, this will definitely help in leveraging things.
Yeah, I think two things I would like to highlight is one is if we could just enable more collaboration between public and private. I think there's a lot of learnings on both sides and a lot of overlap. So if we can just bring all of it together and maybe from policy making perspective and running pilots perspective, if you can come together more effectively. And second is I think just a little bit some more support from after I think the topic of this conversation. Once we are done with the pilot and we know what to do with it, I think that's where the support ends, right? And that's where we need more support. So I think just more support there would be really appreciated. Yeah.
No, thanks, Samrita, for ending on that point. And that's where our initiative, like Samrit, comes in, where it tries to kind of take successful pilots to scale. And we hope just that we can do that with many more startups. I think a very intriguing panel discussion we had. And if I'm just trying to take notes and trying to take just the keywords that I heard, which I think resonates with everybody in the room, things around talent, need, stabilizing solution, incentivizing, and I can keep going on. I think it gives a good menu that one needs to kind of take to the policymakers and say that, okay, you are doing ABC. How can we tie all this together? How can we create an ecosystem, or can we create a platform which brings all the players together? And I think if we are able to do that as an outcome of this summit, I think that will be a big step towards taking AI to scale in the country. Thanks a lot for all the discussions. We may just take one odd question if that's possible.
Now, before you take the question,
Yeah.
I think we need far more attention on organization, and we need many more summaries basically.
Yes, sir. Can we just take one question maybe? Yeah. Sure.
Thank you so much for very interesting discussion. It was lovely hearing all of you. I was just wondering, while AI is inevitable, the expansion of AI is inevitable in markets like India, where labor is available extensively. How do we counter AI in services not taking jobs of people, because unemployment is a big issue. You mentioned about this staff shortage in India, but while AI expansion, as I mentioned, is inevitable, how do we counter it with people losing their jobs, and especially in countries like India, where we have 70% young population?
That's really a great worry. But in one sentence, you need AI in health to aid the worker, not to replace it.
Maybe quickly. So maybe I will just quickly answer that. See, AI can play a big role, and already under ABTM also, NHA is using AI quite a lot to understand where the frauds are happening. And as we are able to plug in those frauds, the insurance premiums will come down and the coverage would increase manifold. So AI definitely has a big role to play there. With that, thanks a lot. Thanks a lot, everyone, for being there. Thanks a lot to the panelists for your time and